We are live, Your Worship.
Great, thank you. Afternoon, Council. I'd like to call a special council meeting of May 20th, 2025 to order with adoption of the agenda. So I want to make that motion for me. Councillor Devlin, second by Councillor Orlando. All in favor? Motion's carried. We are going to go right into delegations and presentations. We have Interior Health here to do their presentation. So Chris, I'll turn it over to you and you're up.
Great. Thank you for having us today, Council, and the opportunity to share with you the health services that we provide to the community of Revelstoke. I'll just pop the presentation that I have up on the screen, if that's okay, and just some acknowledgement that it came up okay would be great, because I'm going to lose you for a second here.
All right.
There. Can you see that okay?
Nope.
Not yet?
Okay.
I'll try this again.
Okay. We've got it up now.
Fantastic. Great. Apologies for the delay with that there. Great. Okay. So we'll just start us off in a good way and just acknowledge and recognize the traditional, ancestral, and unceded homeland of the Senex peoples and the territories of the Secwepemc, Silks, and Ktunaxa peoples, where we live, learn, collaborate, and work together. I'm calling in today from the Secwepemc territories in Salmon Arm. And I guess unfortunately, but fortunately, we've got quite a storm coming through here, but I'm hoping it allows the land to be a little bit wetter and postpone what often we have every summer here with our wildfire season. This is a slide that's gonna let those on the call, Mayor and Council, just orientate themselves to the leadership team. This is the director team that is responsible for delivering health services in the Revelstoke area. And they're listed there by the health sector that they're responsible for. So Carl, who's in the office with me here today, and it's actually his first day with the responsibility of having a responsibility of Queen Victoria Hospital in Revelstoke and Shuswap Lake Hospital in Salmon Arm. He's again with me here today and a part of this presentation on his first day. Angela Zabo will be speaking about the home and community care program, the home health program. Megan Thorne oversees mental health and substance use. And Darren Klassen is primary and public care. He's on the line as well. And then Julie Davenport is responsible for long-term care. So that would be Mount Cartier Court in Revelstoke and the Early Childhood Development Program. So they're all going to have a small presentation here today, speaking about the services that them and their team provided. And really the intent here is to engage with municipal councils like yourselves so that we can provide to you an understanding of the health services that we provide to community. I'd like you to both be aware of that, but also be informed such that when you have constituents come to you, you feel like you've been able to engage with Interior Health in a way that allows you to answer any of the questions that constituents might have for you. So that's really the purpose here. Today, it's really going an inch deep, but a mile wide as we try to cover all those sectors that are on the screen there that you can see my team's responsible for. And then at a future presentation, if there's one particular area that you'd like to ask some more questions about, to hear more about, we're happy to bring that director back where we can dive a little bit deeper into a particular area that you might be of more interest in, or just might have some additional questions. So I'll just pause there to see if there's any questions before we get started.
Any questions, Carl? Seeing none, Carl, I'll just welcome you to Queen Victoria Hospital. Right. Unfortunately, some of us get up there a little more often than we'd like to, but welcome and thanks for what you do. Thanks for taking on that role. Appreciate it. Chris, I think you can carry on.
That's great. Thank you. And I will be looking for your cues there because of the way I'm set up here. I actually cannot see the presentation other than my slides. So any cues would be helpful there. So starting off with Queen Victoria Hospital here, and again, just going to do a brief overview, but happy to answer any questions as we go through this. So you've got a hospital with 10 funded beds, but of course, in most acute care facilities, we do have the ability to flex to higher numbers. So we can actually go up to 15 at that facility in its general medical surgical bed area. We have a secure room where we're able to care for individuals requiring some additional psychiatric care. And then we also have a program that's part of that unit where nurses and physicians are able to support those that choose to have medical assistance in dying at home, hospice, or at site. So just some little bit of information on our general medical surgical unit. We've got a capacity of 2 in our maternity department, 1 funded bed, 1 labor and delivery room. There's a backup delivery room or postpartum private room as part of that cohort as well. Typically, the team is telling me that they'll see between 100 and about 110 births per annum. And of course, babies don't come out in a very staged, predictable way. So we will see monthly numbers flex between about 6 to 15 births per month. And that again is for our maternity unit. Our emergency department, you can see from just the bullet points there, we've got some stretchers, we've got a treatment and isolation room, we've got a trauma room, and Queen Victoria Hospital plays quite a role in responding to some fairly significant motor vehicle accidents along that highway, as well as responding to need from the recreational activities that occur in the Revelstoke, Greater Revelstoke area. So it's a fairly active emergency department room. We'll see anywhere on average from 20 to 25 patients a day in that department. But more recently, we've been seeing a little bit higher numbers, somewhere around the 35, 38s. And I think it's just been more reflective of the recreational activity that's been occurring over the past season here. The operating room, you can see there we've got stretchers, we've got a pre-surgical screening program. So anyone that goes into anyone requiring surgery gets worked up in a pre-surgical screening program to make sure that they're ready for that surgical activity. We've got a number of visiting specialists or surgeons that come into that community to provide the surgical specialties that you see on the screen there. And in addition, we have in the community of Revelstoke, so we would call them resident surgeons, we've got general medicine and obstetrics as well that are there to support your community on a regular ongoing basis. And then in addition to what I would call more of your inpatient activity, which you can see on the screen there, we do have outpatient services at that hospital as well. And again, some of these services do support your inpatients, but a lot of these are outpatient services. So you have a medical imaging department, which provides X-ray, ultrasound, and more recently, because of the generosity of the foundation and donors, you have echocardiogram there as well. You've got laboratory medicine there, which provides some tests in there. That's where all your blood draws would happen. You've got rehab medicine with physiotherapy and occupational therapy on site there, and that's the space as you first enter the building on the right-hand side. There's a pain clinic. You've got respiratory therapists that are there. You've got one respiratory therapist that is at the site 2 days a week, helping patients out in that area. And you've got a diabetic educator, dietitian that's out there as well, supporting outpatient services in Just going to pause there to see if you want to do questions after each segment, or you want to just compile them to the very end, because if not, I would hand off now to Angela Szabo, who will go through the home health community portfolio.
Chris, I think if we can ask questions after each segment, I appreciate that. So before I go to council, I have a couple questions. So the last on this slide is infusion services. Can you elaborate on that for me, please?
Yeah, absolutely. So there's a lot of activity that will typically happen in, say, an emergency department. So you might have folks coming in for ongoing antibiotic treatment, or they might need iron infusions to maintain a certain level of health. We've taken some of those services out of the emergency department space and are creating a semblance of an ambulatory care clinic where people can come in as an outpatient and receive services in a setting that's not in the emergency department anymore. So that's what we're putting in place in Revelstoke, and we're just packaging that as infusion services for the purpose of the conversation.
Appreciate that. And then when you talk about funded beds, so 10 are funded, how do you get payment for the other 5? Because there's quite often, depending on time of year, where we're full. And so how's that work for you?
Yeah, it's a really good question, and just so you know, that facility, despite the increased activity we've seen through the emergency department, has been running largely between 60 and 100% for the past couple of months. Now, when I say that, there are certainly days where they're at 110 or 120%, which would be 1 or 2 additional patients to that roster. But for the most part, there's not a significant inpatient demand. But to your question, we have nurses that are in full-time lines, and we have nurses which are casual nurses. And anytime we need additional workload or support, we have the ability to call in additional staff to provide the care that's required anytime we're above that kind of funded baseline, or I would call it the funded baseline level.
Great. No, appreciate knowing that. And so I want to talk about nursing, but let's talk maybe at the end of your presentation with that. And then for any of us who have been up there in the afternoon, let's say 3 o'clock, it's like happy hour, where it's extremely busy in the ER department, and want to commend your staff for getting the patients through in a relatively quick time, and for the ability to bring staff in to get that done. So thank you.
No, I appreciate the kind words, and I'll certainly extend that to the team. When Carl and I are up there on Thursday, we're going to be spending a lot of time in Salmon Arm and Revelstoke the next 3 weeks. And I believe we actually have a meeting with yourself during one of our initial weeks up in Revelstoke. But I appreciate that, and I'll certainly pass it on to the team.
All right, thank you. Any comments from balance of council? Councillor Devlin, Councillor Stapleton.
Yeah, through the chair, there have been some murmurings, if you will, in the community about increased wait times for laboratory visits. I'm just wondering if you have any insight as to sort of what's going on there. Is that a matter of staffing? Is that more influx of patients than usual? Just so that we have an answer for some of the people in the community when it comes up.
Yeah, it's a good question. It's nothing that's been brought to my attention, I think, on the operations side. So what I'd probably have to do is have myself or Carl come back to you with a response on that. I would say, and I'm hoping this is intuitive, similar to the previous comment about 3 o'clock in the afternoon being busy and emerge. There's likely times, certainly after work and other times during the day, where people will draw on services more so than, say, maybe 10 o'clock or 11 o'clock in the morning. So I'm hoping it's situational like that, and there's not something more significant occurring there. But if that's okay that we get back to you on that, we certainly have an answer when we meet with the mayor in the next couple of weeks.
Yeah, absolutely. I really appreciate that. Thank you very much.
Yeah.
Yeah, thank you. Thank you so much for the information so far, Chris. It's great to hear. I have a question in regards to the capacity of Queen Victoria, some of which you've already touched on, but more specifically, when we see the increase in kind of the extreme sports that Revelstoke offers, i.e., mountain biking and snowboarding, is there any services that the hospital is seeing a demand for that we're not currently meeting, such as I don't know if it would be like a CT machine or something to that extent, and maybe you could just kind of touch on that for me. Thank you.
Yeah, no. I'm starting to pay a little bit more attention to the stats that the local team, and I'm going to be working with Carl on making sure that any growth in services are being met by the requisite response with resource asks, so that we can actually respond to those needs before they become too significant, if you will. So recreation has always been, I think, a hallmark of your community, both skiing and then the mountain biking that happens. I think that's what might be driving some of those numbers that I mentioned earlier. I don't know what your ski season was like in terms of snowpack and all of that, but the team has been mentioning that they're seeing elevated ED visits. Depending on what's required, and again, I'm not too sure if this is answering your question or not, so I'm going to make some assumptions here, but in terms of those increased visits, there's a certain amount of care that site will naturally be able to provide in response to those visits. And some of the care will likely be more acute, where patients will have to be transferred out to what we call a higher level of care location, whether it be Salmon Arm or perhaps Vernon if there's a fairly significant orthopedic requirement to that injury. So I guess short would be, yes, we're monitoring it and certainly want to be able to respond to it if we see the volumes being sustained over a longer period of time. And then please let me, again, I can't see your face or facial expressions here. If there's anything additionally that you'd like me to answer on that, I'm happy to.
Paul, Councillor?
Yeah, sure. And then maybe just one follow-up. I understand there was recently a fundraising campaign for an ECG or an EKG machine. And I just want to see if we're meeting kind of the cardiac needs of the community, because along with the extreme sports, we have the golf course and an additional golf course being planned. So I'm just wondering if there's, are we currently meeting the demands of cardiac patients in the community and those who are having acute coronary symptoms, or maybe you can touch on that for me.
Yeah, and that just because that one's a little bit more focused on cardiac services, which it comes out of another portfolio. I'll follow up with the mayor as well on that question for you. And I hope they're not, I hope golfing and cardiac care isn't connected there, because I know sometimes I feel like I might need some support after a bad round of golf. But I'll certainly have Carl follow up with the cardiac group and just see where that is at, so we can provide a more wholesome response for you.
Ready? Councillor Terry.
Thanks, Chris. Just through the chair, I've got a couple questions about staffing. I was mentioned earlier that the laboratory wait times have significantly increased. Being someone that has to get blood work quite frequently, I'm being told it's due to staffing levels. I'm hoping maybe you could get to the bottom of that and let us know what we can do to help. I should also mention that I'm a property manager in town. I've got nurses, lawn care aides, nursing grad students, as well as doctors that reside in my homes. So happy to help you guys any way possible with housing in any.
No, I appreciate that. Housing is something that comes up quite regularly in our communities in terms of challenges that some of our current staff and incoming staff certainly experience. So we'll be happy to let Carl take in that information locally and see what type of problem solving we have to do.
Okay, and then I do have a quick follow-up. In Fernie, Interior Health offers a grad program to help get nursing students the hours they need to fully graduate. Is that something that could be offered in Revelstoke or just help a few of these people get across the line? Again, just look to help some staffing issues out.
Yeah, it's a good question. I know we offer preceptorship or employed student nurses opportunities to get some of their training at a number of our sites. And I just have to see where Revelstoke is in that. It certainly is a mechanism, if it's able to happen in Revelstoke, to acquaint people, potentially new graduates, to communities, and see if that's a place that they want to practice in. So that'll be something that we can follow up on as well.
Yeah, and that was kind of anecdotally, because I got one right now that moved here, and then turns out she's just a few hours short, so she can't get hired. But happy to see the rest of the presentation and follow up with you guys afterwards.
Yeah, no, that's great. And you certainly have a nice community for a draw for folks that want to come and experience the outdoors and have a good recreational component to their lifestyle. Sometimes it's just dialing in that with lifestyle costs, like you mentioned, housing and stuff. But I don't think you've got a concern with the draw or the appeal of your community from what I hear.
Thanks for that.
That's great.
All right, Chris, we can move on.
That's great. I appreciate the questions, and I think we're over. Angela, I think you're next. So I'll let you introduce yourself and then go into your slide deck.
Excellent. Thank you very much, Mayor and Council, for the time today to share the Revelstoke Home Health and Allied portfolio with you. I am Angela Sabo, the Director of Home Health and Allied Programs. I see on the screen that the notes section is also being shared, and I'm just going to ask that you please ignore that because that's actually not correct information for Revelstoke. So the Home Health and Allied Services, there we go, perfect. We operate 365 days per year. We have an average of 25 to 75 clients at any given point in time, depending on the type of services that the client is accessing. Our team is based out of Queen Victoria Hospital, and as you can see on this slide in front of you, under Who Are We, that we have a very diverse group of team members of professionals. We provide a variety of programs to the community of Revelstoke, including ambulatory nursing, palliative care services, home-based seniors care, home support services, a community bathing program and adult day services, access and flow support, seniors health and wellness, and then our outpatient and inpatient allied health programs. In home health, our philosophy of care is client-centered. And what this means for us is that we wrap services around the client with a single clear contact person or professional that we call an MRC. An MRC is a most responsible clinician, and it's the person that the client knows as their main contact within the home health team. This individual coordinates care with the rest of the home health team, their physician, and other team members in the healthcare system. To highlight the important and involving work of our home health and allied team, I want to share some data with you. Currently, we're observing an 8.8% increase in home support from previous fiscal year. In the last 3 years, our home support portfolio has provided over 38,000 home support hours to clients in the community of Revelstoke. Our average wait time for home support is 3 days. And I want to make special note to celebrate our amazing community home support workers, where we have had a 0% changeover in staff in the last year. In our community social work portfolio, we've seen a 25% increase in the volume of clients that we are seeing and providing supports and services to. And we are seeing a 12% increase in home care nursing visits since the prior year. And so we definitely are experiencing within the community of Revelstoke some evolving healthcare needs and some complexity within our healthcare population that we support through home health and through our allied portfolio. Next slide, please. Chris, can you advance the slide?
Yeah, I'm trying here, Angela. 1 second.
No worries. Beautiful. I want to highlight our access and flow support work that we do, mainly because it's a small team of individuals that are involved with clients as they transition to and from locations, which may include acute care, short stay rehab, our facility respite beds, our hospice or end-of-life beds, and home. These are nurses that are based in the hospital, and they assist by connecting patients to home health or other community programs. They also identify existing home and community care clients so that their care in hospital is as seamless as possible. And so this is a small but mighty group that works within the acute care environment of Queen Victoria Hospital that supports the timely transition of clients through the acute care system. That's our home health portfolio that I wanted to share with you today. Thank you so much.
Thanks, Angela. Are you okay with us asking a few questions?
Absolutely.
So you had stated 3 days wait for home support. Is that, can you just elaborate on that? Is that from initial phone call saying, hey, I need help, or how does that work?
Yeah, absolutely. Great question. And so from the point where we're contacted to request home support services to the first visit of a community home support worker, it's on average a 3-day wait time, which is a really great wait time. Home support services are not deemed urgent or emergent. However, if there is some situation that requires a quicker or a faster response, we do have an escalation process in place where we can flag that, and we are able to provide home support sooner than that 3-day timeline. But the 3 days is about an average of how long it takes from the request for services to when the first service is provided.
I think that's really wonderful. I've just put my mother in a long-term care home in Vernon, and the wait time for the first visit was about 2 weeks, and I thought that was commendable. So thank you for that for our people here in Revelstoke. Council, any questions for Angela? Any concerns? Seeing none, let's move on. Thank you.
Great, thank you. Megan Thorne, are you on?
Here.
Excellent. I'll just pass it over to you to introduce yourself and go through your slides. Thank you.
Thank you. Hello, everyone. I'm Megan Thorne. I'm the Clinical Operations Director for Mental Health and Substance Use for the North Okanagan. I oversee all mental health programming from Vernon all the way to Revelstoke. So that includes acute inpatient psychiatry in Vernon and all other community programs across the North. Chris, can you go to the next slide, please? I'll try not to be bossy. So a bit of a program overview for Queen Victoria Hospital. MHSU is located within the hospital when you first come in and turn to the left. And we provide services for individuals who require moderate to severe mental health or substance use support. Currently, our counseling and treatment team has 1 clinician, and there is very much no wait list at this time. There's a waiting period between assignment and first appointment, and that typically takes 4 weeks. However, it could be shorter. Within the team, we have 1 counseling and treatment clinician, which is a 0.7 FTE, and a substance use counseling clinician, which is a 1.0 FTE. So aside from counseling and treatment, we also provide case management. So case management would be for the folks that would require a little more fulsome support or wraparound support. So we have our treatment support and recovery clinicians and our seniors mental health clinician. So she provides support on a 0.8 FTE. We also have a nurse prescriber, which is a 0.2 FTE. She has finished the training, so that is now updated, and she's able to provide Suboxone and Methadone to clients who require so. We also have a community support worker working full-time. So clients are offered virtual groups from Salmon Arm while they're waiting to see a clinician, for example, a CBT group or anxiety management group and any other psychosocial education groups. Next slide. We're very lucky to have 1 psychiatrist in Revelstoke. She works 3 days a week, Tuesday, Thursday, and Friday, but I believe she's dropped down now to Tuesday and Friday, as she's now supporting child and youth mental health 1 day a week, which is great. Her hours are 8 to 2 p.m., and she also facilitates a yoga group focused on trauma on Fridays. She's very integrated with our psychiatry team here in Vernon. If someone in Revelstoke does require an admission to a designated facility, they would be consulted with the psychiatry team in Vernon and transferred to Vernon to receive that care and discharge from Vernon Hospital. And that is it.
Great, thank you, Megan. So when we talk about the support for those who are addicted and are getting their products, they come to the hospital for that that sort of treatment, or the pharmacy, or how does that work?
So just to clarify, so if someone is perhaps interested in going on treatment,
Right.
Yeah. So we do have a nurse prescriber who can support very I would say, initial medication, which is Suboxone and Methadone. If it's more extensive, there would need to be a consult with a physician for that, which can be done virtually as well. We have a virtual addiction medicine program that's offered throughout Interior Health. So they don't necessarily need to come into acute care to do that. That can be done in community. Sometimes people present to hospital because they are maybe perhaps withdrawing from substances and they do require medical intervention. But otherwise, if you have there's someone in the community who is interested in going on opioid agonist therapy, they could call the community mental health team and they can get connected to the right people to ensure that they get the services that they require, because there is the medication component, but then there's also the counseling component that we would want to attach them to as well.
Great, thank you for that answer,
Yeah.
Megan. And then one other thing, so I've been here a very long time, and most of the locals know you come in the front door, you turn left. And for some of the locals, there's a stigma. They don't want to turn left. If they could circle around the building so no one sees they're going in, because they don't want anyone to know they're having their head ripped. That's community members telling me that.
Yeah.
And so that always seems to be a problem. And so I'm always indicating to people, call the hospital, talk to them about your concerns and see how that can be mitigated. So I just want you to know if your department's getting those calls, it's because people may need the treatment, but they're embarrassed, and there's no shame in seeking any kind of assistance in my mind.
Yeah, yes, thank you for sharing that. And that's unfortunately something that we have to address across the interior. So there's still a lot of stigma attached. I do understand that there's potential for MHSU to perhaps locate to a different area, which may be beneficial as well too. So folks will go into a different space and no one will really know what services they would be accessing. However, we can also in the interim offer virtual appointments, which a lot of folks do appreciate because they can do it in their home. So that's not for all programs, but certainly for some. And our goal is to meet clients where they're at. And so if they're not comfortable coming into clinic, then how can we meet those client needs? And are we able to do an outreach appointment? And so I'd like to believe that our team is as flexible as we can be when supporting the clients in the community.
Great, thank you, Megan. Councilor Chair.
Thanks, Marcel's. Just through the chair. I'm familiar with Dr. Johnson. I think it's great that she's switching into a supporting child and youth mental health 1 day a week, but I'm worried about the lack of services that are being left behind as she makes that transition. What can council do, or what is Interior Health doing to help those that are feeling left out now?
Well, thank you for the question. I believe at this time, and of course that can change quite quickly, but we don't have a wait list for psychiatry, which is pretty huge. And so I do believe that she does, and I don't want to speak for her, but from what I understand is that she does have capacity to support the child and youth population, which is also very much a growing need when you look at our utilization data. And so I think what we continue to do is we continue to monitor our wait lists if we have them, and also our utilization. So at this current time, we do believe that there is capacity. Should that change, then I think we need to respond in such a manner. I don't know if that answers your question.
No, that's great. That does. My next question, just to follow that up, is if there is a need, will she be offered more days, more hours? Or is this, I don't know if this is an Interior Health policy or if this is Dr. Johnson's choices of days to work.
Sure.
So.
If there was a need, we would certainly have the ability to offer her more hours. Again, I don't want to speak for Dr. Johnson, but I do believe this is the work-life balance that she wanted. And I think that's what drew her to Revelstoke. I do also believe she's supporting some of her old Calgary practice. Again, just being mindful of her and what I share, because I don't 100% know. But to answer your question, if there is a time when the need is there and utilization is up, that would be our job then to look at how we would respond.
Okay, perfect. Thank you.
Thank you.
Questions, council? Seeing none, I think we can carry on. Thank you.
Thank you.
Great, thank you very much. We're going to go on to public health services now, and I believe we have Darren Clausen on the line to lead us through his slides. Darren?
Yeah, good afternoon, Mayor and Council. Thank you for having me. I'm calling in from Vernon, the traditional territory of Syilx Nation. My role is the Director of Primary Care and Public Health. I'm only speaking about public health today, despite there being actually a lot of exciting work happening with our primary care network within Revelstoke. And the reason for that is if you're interested in engaging or having a presentation on that, I think it's important that we have local primary care providers and a lot of our other community partners present for that conversation too, so that we can have adequate representation. Nonetheless, I'm going to talk about public health today. We have a team of predominantly public health nurses that a couple of them that work in regular positions directly in Revelstoke, and a team of public health nurses in Sicamous and Salmon Arm that often come into the community and support as well. If we were to really summarize public health services and what our main objectives are, they're really three. One is maternal, child, and family health. Second is healthy schools, and the third is communicable disease prevention. So when we're talking about maternal and child health, family health, there's a couple of different key components that we're quite focused on. First and foremost is any new families, anybody that's given birth recently. Our public health nursing team is connecting with them within 48 hours of birth. A lot of times that's through home visits, or where it's perhaps their second or third delivery or child, and there's less concerns and there's no risk. It may be a phone-based conversation. So Revelstoke averages somewhere in the ballpark about mid-90s for their birth cohort per year. And so for each of those individuals, public health nursing is reaching out to the family, connecting with them, supporting them with any breastfeeding supports, home visits, weight checks, and so forth. And of course, more recently, we have Ariel, a midwife that's come into the community. And so we're working with Ariel just around how we're coordinating some of those services to ensure kind of timely access and a coordinated integrated system between the health authority and services outside of the health authority. Within that child and family health piece as well, we run child health clinics. In a given year, we average about 900 different appointments for those families. And with that, that's, screening parents for postpartum depression, addressing any concerns that parents have, checking all the milestones and so forth that children are progressing through, and of course, having any of the conversations and potentially administering any routine immunizations within that. So typical timeline or frequency to which we'd be seeing those individuals is when a child turns 2 months, 4 months, 6 months, 12 months, 18 months, and then between the ages of 4 and 6. That's typically kind of the routine schedule. And we will modify that schedule to either meet more frequently if there's families that are in greater need and are needing more resourcing and supports out in the community, or kind of modify that based off of any number of kind of indicators that are decided upon between our medical health officer, our public health nurses, and the families. And then in terms of healthy schools, every school has an assigned public health nurse. We really try and focus on that longitudinal kind of relationship between school and public health nurse. They're there really to support and guide any health initiatives as needed, support teachers, say, in the event that they have a child with a severe anaphylactic reaction and are needing some support around signage and EpiPen use and so forth. They're there to support with things like that, or a child comes in into their class and they have type 1 diabetes, and there's some additional kind of components that need to be considered in terms of preventing kind of hypoglycemic episodes and like low blood sugar episodes, things like that. Our public health nurses are there to connect those resources and support in that way. And then the third main objective is really communicable disease prevention. It's probably the most prominent one that people would be aware of is our respiratory immunization campaign. So at times we're setting up mass immunization clinics, or at other times like we're using the boardroom, for example, at Queen Victoria Hospital, and providing both COVID and influenza immunizations for families and everybody really. We also, though, support rabies post-exposure prophylaxis, do all the tuberculous skin tests, tuberculosis prevention treatment for anybody that has like a latent tuberculosis infection, and also offer kind of adult-based immunizations. And in a given year, that's about 700 appointments or so. And then in terms of upcoming initiatives, there's a couple of things that are on our radar within public health that we're working on. So regionally, we're developing a sexual and reproductive health service plan to really enhance certified nursing practice in areas such as contraception management and STI testing. And so that's up and coming. We have a relatively small amount of funding to be able to implement that in addition to options clinics throughout our region. And so that will pair nicely with some of the work that we're doing on the primary care network plan end of things. So we just want to make sure we're creating kind of a coordinated system that makes sense. But hopefully we'll see in Revelstoke soon some enhanced access to a nurse that is specifically trained in supporting STI testing and contraceptive management. The immunization action plans, this is kind of a global interior health and BC-wide plan. There's an acknowledgement that our immunization rates are typically suboptimal to what we would like them to be. So just to give we usually measure it at age 7. So we'll look at the age 7 cohort and see how many people are fully immunized against all routine immunizations. And so Revelstoke, we sit somewhere in the ballpark, and we bounce from year to year, but we're between 50 and 60% pretty consistently. Ministry of Health target and most evidence would suggest we should be at minimum 70% or higher. That's not an anomaly for Revelstoke compared to any other community, both locally in BC and nationally. This is a concern across the board, but our intent with an immunization action plan is to really improve access to the immunizations, be more proactive in catch-up efforts, develop a better and stronger communication plan that's really based on evidence-based recommendations. And so more to come in that regard. And then the last one is the enhanced school immunization catch-ups. And so as part of a routine immunization schedule, our public health nursing team goes into schools in grade 6 and in grade 9. And is now not just offering those routine immunizations. So grade 6, for example, is your HPV vaccine, but we'll offer all other vaccines that they're maybe not caught up on, support individuals in getting caught up. Of course, we do that with parent consent and all the consent processes in place with that. But more recently, we're also looking at being more present in the high school and ensuring that people have the opportunity to get immunized in a timely way. Yeah, and I think that is the only slide I have. Any questions for me?
Thanks, Chris. I was going to ask about the school program, if you still went in schools, and I can remember I still suffered PTSD from getting the shots when I was a kid in school, and tried to skip those, and I keep talking about the nurse painting a target on my butt and coming at me and throwing that dart, and that really wasn't the case, but that was the story I told my parents. So tried to get out of it, never worked. So it's wonderful to see that you're still doing those sorts of things, and how public health has come such a long ways from when I was a kid 60 plus years ago. So thank you for what you do in the community. Councillors, any comments or questions for Darren? Seeing none, they're all suffering PTSD from those shots too, so, and they're just kids. Anyway, thanks for what you do. We're going to carry on.
Thank you. And we have Julie Davenport next to talk about health. Julie.
Hi, everyone. My name is Julia Davenport. I am Director of Long-Term Care for North Okanagan and Early Childhood Development for all of Interior Health. I'm going to focus on long-term care today. So long-term care is facilities within Interior Health and actually beyond, in which we provide nursing care for those who need nursing care 24/7. So this is where your loved ones who are no longer able to live at home or in assisted or independent living, they work their way to us. Typically, we're there for the end of the journey, and we provide, like I said, that extra support. And our focus really in long-term care is all about quality of life. And so how can we support and really make the best of the years that our clients have? When we look at long-term care, we very much think of it as being able to look after those who are able to look after us. And so when we look at who's in long-term care facilities, it's very much those citizens. You come across the teachers, the nurses, and ones who work, of course, in public. And so for us, it's such a privilege to be able to look after those, like I said, who cared for us for so many years. Specifically to Revelstoke, we have Mount Cartier Court. It's on the grounds of the Queen Victoria Hospital. It's actually, you can walk through the hallway, which is nice. That's ease of access to the acute facilities. It's 42 beds. I have to joke. I always say that if I have to end up in long-term care, I'm absolutely picking Mount Cartier Court. It's a beautiful building, the layout, the views, and just it's an incredible place. And so we're very lucky to have that in the community. It has 42 beds on the grounds. Of those, one is dedicated to the end of life program and the other is dedicated to respite. And that's for seniors in the community. And respite, of course, is that, you may have a trip that you need to take. You want to make sure your loved one gets care while you're gone. And also too, for loved ones, just being able to get that break, because, the care, as it becomes more complex, it can be hard on families. So respite is a great way to be able to get that care while getting the break that you need. Mount Cartier Court, as any long-term care facility, is very much linked to the larger system. We are very fortunate to have a robust home health program, and so many of our clients are identified through home health and work their way to us and through the hospital. And that's where Charlene and Jen and the team in acute, they provide such great care when the care becomes so complex that we're unable to provide it at Mount Cartier Court. We're also lucky in that, and this is a bit unique to the long-term care facilities, to have a foundation that is so strongly committed to our program. And so really need to take a moment to give kudos to the Queen Victoria Hospital Foundation. Their support, especially of the end of life program, is reflective of the quality of the care that we're able to provide. What I also appreciate just working with the auxiliary group and the different groups is just the commitment to community. And that strong linkage really, I think, really connects us not just to community, but also holds us accountable, which is so important when it comes to caring for community members. So that's long-term care. Like I said, we have recreational therapy programs. We have occupational therapy, physical therapy. We have all the different programs on that, like I said, to support our seniors. And so it's quite a privilege. I have to say, Revelstoke too, I've spent way more time at the Railway Museum than I should probably admit. And mostly it's because of my two boys. And that's been like, if we went to Revelstoke, we went to the museum. So it's, and there's a little yellow house for sale at Revelstoke that I keep looking at that I would buy in a heartbeat if I could. I love Revelstoke, the community. And that's long-term care. Any questions for me?
Thanks, Julie. Appreciate that. You may not be aware, but I spent 43 years in funeral service in our community, so I'm well versed on the end of life care and the care in Mount Cartier Court and what you provide to the community. And so grateful for the staff. I've had many of my extended family go through there, and I have one aunt in there now. And so I look at those sorts of things and go, crucial part of our community. I know when the foundation was put in and we talk about long-term care, the thought process was that usually people would be less than a year in a care facility before end of life. And because of good care, these people are lasting much longer and enjoying their lives. So I just want to say kudos to your group and thank you for that. Council, any questions for Julie regarding extended care? Councillor Stapenhurst.
Maybe not so much a question for Julie, but through the chair to whoever wants to take a crack at this one. We just had a town hall meeting in regards to emergency preparedness. So my question is, what has Queen Victoria Hospital done for emergency preparedness, and then what can the city do to help support them in the event that we're faced with the unexpected?
Good question.
Chris, Do you want me to answer for the long-term care side and then hand it over to you for the hospital side?
Why don't I provide a perspective to the
Okay.
council we just went through, and then if anybody wants to jump in afterwards, please do. So Mayor and Council, we just held a Code Orange exercise in the North Okanagan, largely focused on Revelstoke and Salmon Arm, with our partners at Health Emergency Management BC and the community. So Revelstoke, I believe fire and police were involved, but I could be wrong. I think the fire department was for sure, where we simulated a bus accident on the highway close to Revelstoke, and then we had to respond in a manner that would be consistent with that type of event to ensure that Revelstoke, Salmon Arm, and other facilities were able to accept and then care for those that were injured on the bus. So we call these tabletop exercises that attest our emergency response preparedness and our ability to execute our plans. Quite successful, and I think it allowed the team to do a lot of reflection around what they would have to do in a real life situation should something like that happen. We're going also into wildfire preparedness season, so a lot of activity and conversation now is back to, it's that time of year again. So we're going through our various plans and response mechanisms to make sure we're prepared to respond during wildfire season. So these are part of our annual cycle of work where we do emergency planning and response and pull in acute care sites and in some cases long-term care sites, because they could have a role to play in what I just described. So I'll just pause there, and any of the team is welcome to add to that. And then if you've got a follow-up question, I'm happy to answer it if I didn't cover everything that you were looking for.
We should get an invoice, shouldn't we? Get the next one. Maybe just a quick follow-up.
Sure.
I think it's great to hear that there's, tabletop exercises being had in regards to, situations that may occur on the highway. But when I was quickly just, going through your presentation, I kind of did a rough count of, roughly 80 beds in the hospital, including Mount Cartier. So, if, for example, we did need to evacuate the city of Revelstoke, that would be 80 people, give or take, that are heavily dependent on assistance being needed. So that's my concern, and I'm slightly reassured knowing that we're doing these tabletop exercises, but just what can we do if that was the situation where we had to, evacuate the whole town? And then just for background, my mom was a nurse and I was a medic down in the States for years, and one of my first assignments was working in a mass casualty situation station. So that's a little bit of a context for the background where I'm coming from. So thank you.
Any answer to that question, Chris?
Yeah, and Julie, I might have you draw on this a little bit, because in our, so the council and mayor, when we have to do wildfire planning, and if any communities are threatened by wildfire where, a certain kilometer radius is breached, the organization has a program that's part of the emergency response for the entire health authority. And they actually look at bed and bed capacity at other sites within in Interior Health and other health authorities as a mechanism to plan for transfer should you just describe should what you just described actually occur. So Julie could possibly walk through, if she's able to walk through some examples where in the past capacity has been created, say in Salmon Arm, for other regions where we've had some pressures, where we had to move some sites, whether it's long-term care sites or acute care sites, to add capacity in one community to help out another community, if that makes sense. But Julie, did you want to maybe just give some examples of the past here?
I can't. I'm mindful of Aaron's hands up though. Aaron, do you want to comment before I do, or what would you prefer?
Aaron, you have a comment?
I have comments and questions, but it's unrelated. I was just getting in line for next question.
Okay. No worries. So for us, for long-term care specifically, like we do planning now all year round. So what started with wildfire planning, we now actually have our lists in place. So we know who's in our building, what type of transportation they would need, where they would go, what requirements we would need to actually get them supported. Because, you know, it's funny, it started with wildfire, but really an emergency can happen at any moment. What we have as part of that planning is, depending on what highway or where it would be, if there's any highway closures, where they would go, everything is at the ready. We have supplies on hand. We have buses at our disposal within Interior Health and throughout, particularly Northern Health, that we have access to. So it's like I said, what became a seasonal event is now a year-round event, working very closely with HEM-BC. And so those processes, and actually the work that we've been doing, we now share with other health authorities and in Interior Health, just given sadly the how much experience we've had, whether receiving or sending. So for Mount Cartier Court, if we got a call today saying we need to evacuate, we have our plan. If we got a call today saying that we're taking clients, we'd be at the ready as well. So it's become quite a robust system, and one that, like I said, we share with others.
Great, thank you. Follow up, Councilor?
No, thank you. Appreciate it, sir.
Councilor Orlando?
Hi, thank you. This is just a general question. It seemed like we were transitioning to questions for everyone on the panel. I am the council rep to the Revelstoke Community Housing Society. This morning, we spent time working on with the development team on a new building that we're putting up in Southside. While I was at the SILGA conference a couple of weeks ago, I connected with members of the Healthy Community Development team, and they had mentioned that Chris is working on a housing plan, or Interior Health is working on a housing plan. What my question is related to that plan. I would like to find out a little bit more. And also with a view towards building partnerships, starting a conversation about options, connecting the two. So I was wondering if we could get a little bit more background on those options. And just a note, many of the communities in Interior BC, as you are all well aware, have challenges with physician recruitment and retention. One of the challenges we are seeing here is more aligned with key staff roles at the hospital, for example, especially critical services that don't have a lot of staff, such as maybe lab work, et cetera. So I'm hoping to get a little bit of an update on those options for housing and future potential partnerships.
Yeah, thank you for the question. We see in some of the communities where they've had some success that there's often been some local initiatives, if you will, to draw in whether it's businesses or nonprofits to provide housing solutions. And I think this is healthcare, this is education, this is emergency services. But I'm thinking of an initiative in Vernon where Community Futures, which is one of the nonprofit organizations in town, was able to come up with some housing options, suites, if you will, or a couple bedrooms in a house that provided the means for physicians or health workers to be able to have a place to touch down as they're either coming in as a local situation to check or as a newly hired healthcare worker until they establish themselves. So I think any opportunity that, and again, I'm happy to have a discussion with you, Aaron, offline, or Mayor and Council. Any opportunity we can look at that eases the burden of housing for those that are coming in, I think certainly helps not just health services, but a number of sectors bring key positions or key jobs into community. So it's probably my quick comment here, just I guess given where we're at here on the clock, and thinking it's a more fulsome conversation than just a couple minutes here at the end of the presentation. But I'd be happy to speak to you more formally, Mayor, or anybody in the community that would like to hear more about this. I think collectively we're all interested in making sure certain services are able to attract key professionals in our communities to keep them vibrant and being able to offer the services that we've just described here.
Thanks, Chris. Follow up, Councilor Orlando.
Your worship, no, just thank you, Chris, and absolutely would look forward to continuing that conversation with Interior Health. Thank you.
Any other questions from council?
I just got a couple of.
Mr. Parliament, go ahead.
Thank you, gentlemen. I'm glad to hear that you're going to be coming to Revelstoke and meeting with the mayor and the local team here. I just want to let you know a big bouquet to IHA and the hospital, sorry. Queen Victoria and Revelstoke. I've been here just less than 3 years, and I've had to visit that hospital on 3 different occasions, one for a broken thumb, one for surgery. I had some skin cancer taken out, and also one for my annual physical and medical. And I gotta say, the care in this community is top notch. Everyone in the hospital, to the medical clinic, to all the allied healthcare providers, my experience in the Revelstoke Hospital has just been tremendous. I just want to pass that on because there's no bias here. I'm new to the community. I didn't know who Dr. Batchelor was or Dr. McDonald or all the support people, and they've just been terrific. So just want to share that with you and your team. Thank you.
Great, thanks.
Sincerely appreciate that. It's really good feedback. I'll share that with the team. And you've got a great health services team in Revelstoke, no doubt. And I certainly know that they're proud to provide care to that community right across the board, whether it's Angela's program, Carl's program, which he's picking up on here, Megan, Julie, Angela, all of them have a great team that's committed to that community. Thank you for that.
Thank you. Any other comments, questions?
Yeah, sure.
Councilor Chair.
I'll take another shot here. Another frequent flyer at the hospital and with Interior Health. I think we do have a great hospital. I think we got great staff. I'm wondering if the building's fully utilized to the best of its capacity with some of the rooms on the upper room. Is there anything we could, again, is there anything you guys have planned to change or anything that we can do? I know that some of the rooms are just being used as storage or once a week when somebody would come to town. So just a bit open-ended there, but.
Yeah, it's a good question. We started work to look at what we call a site utilization. So it's a study to see what the facility is able to provide in terms of care, just not now, into the future. So we're starting to look at some of what you've raised here, knowing that we want to make sure Queen Victoria Hospital is well equipped to provide care in the years forward. So that study's in the early days, and we're just going to be following up with physicians and staff who were part of that study and start prioritizing what we think would be some key areas to refresh, to be able to, again, to provide services in the years out from now. So more to come on that, but we certainly have our eyes on what you just described.
Yeah, that's great. I look forward to hopefully if that report becomes public, seeing it, or if not, just chat with you guys in the future about it.
Yeah, no, for sure. Yeah.
Good. Any other comments? Seeing none, thank you all for your presentation and taking the time. I know we've gone a little longer than we wanted to, but important. That's why we're willing to have a special meeting to hear what you are doing. So thank you again. Looking forward to our meeting. Good to see you again, Chris. I'm looking forward to meeting you in person, Carl. Thank you again.
Appreciate the opportunity to present, and all the best to everybody. And we'll talk to you soon. Take care.
Thank you all. Take care. All right, council, I'm going to call for termination of the meeting. Councillor Devlin, Councillor Stapeners, all in favor? Motion's carried. Thank you. Thanks, Aaron. Appreciate you being here. All right, we're done for the day.